Hi, my name is Sarah Rutherford. I'm an assistant professor of medicine at Weill Cornell Medicine in New York. And I presented the results from the SWOG S1826 older patient subset. This was a clinical trial that randomized patients with newly diagnosed advanced stage Hodgkin lymphoma, stages 3 to 4, to either nivolumab plus ABD for 6 cycles versus brentuximab vedotin ABD times 6 cycles. And it was actually presented at ASCO 2023 and at ICL 2023 as well by Dr. Alex Herrera on the whole study group. But I specifically looked at the patients who were 60 and older. There were about 100 of these patients, which is roughly 10% of the entire patients who were enrolled on the study. And we really found striking results. First, the nivolumab ABD treatment was much better tolerated than BV-ABD. There were a lot less adverse events, so particularly nausea, diarrhea, peripheral neuropathy, sepsis, and infections were much less in the NABD group compared to BV-ABD. And most strikingly was that the efficacy was really impressive in the NABD group as well. So actually, about 88% of patients on NABD completed treatment at the time of data cutoff, whereas a third of patients on BV-ABD had discontinued primarily due to adverse events. And unfortunately, 10% of patients actually died on treatment on the BV-ABD arm. So clearly it was better tolerated to get NABD compared to BV-ABD. And then again, what was really striking of these progression-free survival results. So with a 12.1 month median follow-up, the PFS for NABD was 93% versus 64% with BV-ABD. And the event-free survival was also statistically significantly higher in NABD compared to BV-ABD. And as I've said already, that there were more deaths on BV-ABD compared to NABD. So this really is an exciting treatment. I've started to adopt it already for my patients who are 60 and older, and clearly we need longer follow-up. But I believe it's poised to become a standard of care for patients with advanced stage Hodgkin lymphoma who are fit for anthracycline-based chemotherapy, particularly in this older age range of 60 and higher.